Good morning, board members. Thank you for the opportunity to present our proposal for the new Hematology Center of Excellence. Over the next few minutes, I will walk you through the vision, staffing needs, operational costs, revenue projections, and overall financial outlook of this service line, which we believe will significantly enhance our ability to deliver high-quality care to patients with blood disorders. So here's a table of contents for your reference. We'll start with a quick introduction of hematology, followed by an overview of our proposed service line, organizational structure, staffing and equipment needs, supplies. We'll go over revenue projections, provide some income and balance sheets, as well as a break-even analysis. We'll discuss some marketing and outreach proposals to help with the growth of patient volume and our implementation process. And then finally, we'll discuss how this may impact our community and the next steps for this proposal. So thanks for listening today. Hematology is the branch of medicine that focuses on the study and treatment of blood disorders. This includes conditions related to blood cells, so red cells, white cells, and platelets, the bone marrow, blood vessels, and clotting mechanisms. So hematologists will diagnose, treat, and manage a wide range of diseases, including anemia, hemophilia, sickle cell disease, lymphomas and leukemias, and other blood cancers. The field encompasses both benign or non-cancerous and also malignant or cancerous conditions requiring specialized knowledge and treatments. These diseases affect millions of people worldwide and require specialized care. A Hematology Center of Excellence is established to provide specialized high-quality care for patients with blood disorders, ensuring better patient outcomes through expert diagnosis and treatment. By concentrating specialized knowledge, advanced technologies, and cutting-edge research in one location, our Hematology Center of Excellence offers access to personalized care plans, innovative therapies, and clinical trials that may not be available elsewhere. This centralized expertise enhances the efficiency of care, improves the management of both common and rare hematologic conditions, and provides collaborative environment for healthcare professionals. It can also be used as a hub for education and training, helping to advance the field through ongoing research and innovation. There's a growing demand for specialized hematology care as blood-related disorders like leukemia and lymphoma continue to rise. Our current services do not fully address the specialized care and treatment pathways that these patients require. Establishing a dedicated hematology center will fill this gap and provide comprehensive care to these patients. The Hematology Center of Excellence is designed to provide a comprehensive, patient-centered approach to the diagnosis, treatment, and management of a range of hematologic conditions. Our goal is to create a center where patients receive coordinated care across various specialties, providing a holistic approach to our medical needs. As you can see here, our vision is to be the leading provider of hematologic services in the region. Additionally, the Hematology Center of Excellence may also serve high-risk individuals or those with genetic predispositions to blood disorders, offering specialized care such as genetic counseling, screening, and advanced treatment options. The center would also attract patients seeking second opinions or those who require multidisciplinary care from hematologists, oncologists, pathologists, and other specialists. And here's just a list we put together of the most common benign and malignant hematology that we would see. The service line will deliver both acute care for patients undergoing treatments like chemotherapy and blood transfusions, as well as chronic care for patients managing long-term conditions like sickle cell disease, hemophilia, and anemia. The Hematology Center of Excellence will be located in the main hospital with easy access to the emergency department and also oncology services. Care will be provided through a combination of inpatient and outpatient care with an emphasis on coordinated care among multiple disciplines, including nursing, lab services, and social work. They will operate 7 days a week in the inpatient care, available 24/7, and the outpatient services would be Monday through Friday during standard business hours. We do have the opportunity to add extended hours if needed based on demand. This can be achieved through a team-based multidisciplinary approach involving the hematologist, oncologist, nursing, and other support staff. So the patient care pathway at the Hematology Center of Excellence is designed to provide a seamless multidisciplinary approach, ensuring comprehensive care from diagnosis to treatment and follow-up. Patients are initially referred by primary care providers, EDs, or oncologists based on symptoms or routine screenings suggesting blood disorders. Upon referral, a hematologist, nurse practitioner, or PA conducts a thorough assessment, including physical exam, medical and family history review, and diagnostic tests such as blood work, bone marrow biopsies, genetic testing, and imaging. The results are discussed with the patient, and treatment options are explored. Treatment planning involves a multidisciplinary team of hematologists, oncologists, oncology nurses, dietitians, social workers, and counselors who collaborate to develop a personalized care plan. Patients are educated about their treatment options, the risks, benefits, and side effects, with informed consent obtained for procedures like chemotherapy or stem cell transplants. During the active treatment phase, patients may undergo chemotherapy, blood transfusions, or stem cell therapy with regular follow-up visits, blood tests, imaging, and clinical assessments to track their progress. Support services such as nutrition counseling and emotional support are also provided, along with symptom management and palliative care if needed. After completing treatment, patients enter a surveillance phase for ongoing monitoring of recurrence or late effects, with regular checkups, blood tests, and imaging. Long-term care plans, including lifestyle modifications and psychological support, are provided, along with referrals for chronic conditions like sickle cell disease. Clinical research coordinators can also offer enrollment in relevant clinical trials, ensuring continued support for patients beyond their treatment. So our hematology center will be managed by a service line manager responsible for overseeing daily operations and ensuring adherence to quality standards. The service line follows a vertical hierarchy with the service line manager at the top, supported by a clinical leadership team, including hematologists, nurse practitioners, PAs, who guide patient care. Under them would be the nursing team, consisting of oncology nurses, medical assistants, and various support groups, such as social workers and dietitians, who also play a crucial role in the patient management and support. And then there's the administrative team, who handles our billing, coding, scheduling, and other office support functions. So here again is another viewing of the key clinical roles at our hematology center. These professionals play the central role in patient care, with hematologists and oncologists responsible for diagnosing and treating hematologic conditions. The NPs and the PAs support that role in patient assessments and treatment management, and then the oncology nurses provide direct care and emotional support to our patients undergoing these treatments. In addition to clinical staff, we have a team of social workers to assist with emotional and financial support for patients, dietitians for the nutritional counseling, and administrative staff to handle scheduling, billing, and coding. So to provide the high quality care, we will need a total of 36 full-time equivalents, including hematologists, PAs, oncology nurses, social workers, and administrative staff. You can see the breakdown of the FTE positions in this chart. Our estimated salary cost for these positions is around $3.37 million annually. We will require several specialized pieces of equipment, including hematology analyzers for blood tests, a CT scanner for cancer staging, and chemotherapy infusion pumps, among other items listed here. The total initial retrospective cost for these items is estimated to be about $1.015 million. To ensure optimal performance, we will also need service contracts for equipment maintenance. So the annual cost for these services in combination is expected to be about $115,000. You can see the breakdown here. Our consumable supplies will include chemotherapy drugs, blood transfusion kits, and bone marrow biopsy kits. These supplies are essential for providing care and are expected to cost us about $1.71 million annually. So now let's take a look at the revenue projections for the Hematology Center of Excellence. Revenue will come from several sources. Chemotherapy treatments, which generate about $3.5 million annually, blood transfusions, which we're estimating to be about $1 million annually, bone marrow biopsies generating about $350,000 annually, and our outpatient visits, which we expect to be about 5,000 visits per year, adding up to a total of about $1.25 million. So this brings our total estimated annual revenue to $6.1 million, which will help cover the cost of staffing, equipment, consumables, and service contracts, with the potential for a positive margin in the longer run. Here's a breakdown of the revenue projections for key services offered at the Hematology Center. So for chemotherapy, for instance, the unit cost per chemotherapy treatment will provide us about $17,500 in revenue. And if we're projecting about 200 sessions per year, that gives us a total revenue of $3.5 million. Blood transfusions bringing in about $1 million, bone marrow biopsies $350,000, and outpatient visits at $1.25 million that we discussed. So again, total revenue equaling about $6.1 million. Our projected income statement indicates that total revenues will be approximately $6.1 million, while total expenses, so this is our staffing, equipment, consumables, service contracts, should be around $6.21 million, resulting in an initial financial deficit. But as patient volumes grow and we redefine our process, we anticipate the service line will become financially sustainable with a positive cash flow in the future. Here's our balance sheet, which shows the initial investments in equipment, including the CT scanner, hematology analyzers, all as assets. The corresponding liabilities include the cost of staffing, consumables, and service contracts. The balance sheet outlines our projected assets and liabilities for our center. Our assets are valued at about $1.55 million, while our liabilities total approximately $6.21 million. So this reflects that initial financial commitment to the service line and shows the relationship between our capital investments and our operational costs. So then we determined our break-even point. So we had to calculate our fixed and variable costs and our revenue generated per patient. The hematology center is expected to break even by the end of month 14, is our estimation, driven by steady growth in patient volume, particularly through outpatient services and chemotherapy treatments. With an anticipated annual increase in patient volume of approximately 17%, the center will see rising revenue that will cover both fixed and variable costs, positioning it for long-term financial sustainability. Some of the risks include market competition from neighboring hospitals, lower than expected patient volume, and some others listed here. To mitigate these risks, we will focus on targeted outreach to primary care providers, cancer centers, and specialized referral networks. So I want to dive a little deeper and talk about these line by line. First is the market competition. So the hematology center will face competition from other hospitals or specialty centers offering similar hematology and oncology services. Competitors might have established reputations, brand recognition, larger patient bases, which could impact the center's market share. So our mitigation strategy would be differentiation. We want to focus on providing a high-quality, multidisciplinary care model that includes not just hematology, but also oncology, nursing, social work, dietetics, and clinical research all in one place. This comprehensive, patient-centric approach can differentiate the center from all the competitors. We would establish strategic partnerships with local primary care providers, oncologists, and insurance networks so we can build patient referrals. In terms of branding and marketing, we would develop a targeted marketing campaign to raise awareness for the new center, emphasizing the state-of-the-art technology, high-quality care, patient outcomes, and we could also leverage social media and patient success stories. We can utilize testimonials and patient stories to build trust and promote positive outcomes, which can increase our patient volume and loyalty. Speaking of patient volume, one of the other major risks in a new service line is that the expected patient volume might fall short of projections, leading to financial underperformance. So this could result from lower referrals, lack of patient awareness, or a longer adoption period by the community. So to mitigate this, we would do a few things. Number one, referral networks. Establish strong referral networks with general practitioners, family doctors, and specialists in the region to ensure steady patient referrals. Regularly engage with referring physicians through educational events, seminars, newsletters. We can engage in community outreach programs to educate the public on hematologic conditions, preventive care, and services offered at the center. We can host free screening programs for high-risk populations. We can use telehealth services for consultations, especially in outpatient setting, to cater to patients in underserved areas or with mobility limitations. This will increase accessibility and patient volume. And we can develop patient retention programs such as regular follow-up appointments, support groups, educational seminars to ensure ongoing care and long-term relationships with patients. Next is our staffing shortages and retention. So hematologists, oncology nurses, and other highly specialized staff are in high demand and might be difficult to both recruit or retain. Staff shortages can lead to burnout, lower patient satisfaction, and delays in treatment. So to mitigate this, we want to offer competitive salaries, benefits, and professional developmental opportunities to attract and retain highly skilled staff. We want to create a strong onboarding and training program for new staff members with a focus on ongoing professional development. We want to encourage career advancement within the organization. We want to prioritize staff well-being with wellness programs, flexible work schedules, and a supportive work environment to reduce burnout and increase job satisfaction. And then lastly, we want to partner with academic institutions and medical schools to build a pipeline of qualified graduates. We can also consider telemedicine opportunities or remote consultations for specialists who may not need to be seen physically in the office at the time. Next is the risk of financial sustainability and cash flow. So the service line is expected to experience a financial deficit in its first year due to initial capital investments in equipment, salaries, and consumables. Without careful management, it might struggle to achieve profitability, especially if the volume of patients doesn't meet its projections. So we would mitigate this by establishing flexible financial plans that allow for adjustments in case of lower than expected revenue. We can focus on cost control without compromising the quality of our patient care. In addition to traditional treatments, we can explore other revenue sources like clinical trials, research collaborations, and external partnerships with pharmaceutical companies or universities. We can delay or phase some of the capital expenditures, such as additional equipment or infrastructure, until the center achieves a higher patient volume and more consistent revenue. Lastly, we can explore potential for government grants, such as research funding or donations from philanthropic organizations to support early stage operations. Next is the risk of regulatory compliance and legal risk. Healthcare services, especially in oncology and hematology, are subject to stringent regulations, including those related to patient privacy or HIPAA, quality standards, billing and coding, and safety protocols. Failing to comply with these regulations could result in legal liabilities or loss of accreditation. So to mitigate this, we would implement a robust compliance program, including regular audits, training, and awareness sessions for all staff on regulatory standards and ethical practices, have a dedicated legal team or external counsel specializing in healthcare law to ensure compliance with all relevant regulations, including billing, patient rights, and quality standards, pursue certifications and accreditations from relevant bodies, so like the American Society of Hematology, the American College of Surgeons, as this will not only ensure compliance, but it also enhances the credibility of our center. And we can develop a comprehensive risk management plan to address potential patient safety incidents and malpractice issues, including proper documentation and patient consent procedures. Then we have our technology failures or delays. The center will rely on expensive medical equipment and IT systems to deliver care, and any delays in equipment installation, maintenance issues, or technology failures can disrupt our operations and affect our patient care. So we would mitigate this by establishing strong relationships with reliable equipment suppliers and technology partners to ensure prompt delivery, support, and maintenance services, create a preventative maintenance schedule for all major equipment and technology to reduce these risks of failure. Service contracts with the equipment suppliers should ensure timely repairs and reduce our downtime. We would invest in redundant systems and data backup to mitigate any IT failures, ensuring patient records and care plans and always have accessible and secure resources. And then we would provide ongoing training for clinical and technical staff to ensure that they are fully equipped to operate and troubleshoot any technologies. The last risk we talk about is patient safety and quality care. Ensuring high quality care is essential in hematology, particularly with the complexity of treatments like chemotherapy, stem cell therapies, and blood transfusions. Any issues related to treatment errors, misdiagnosis, or poor patient outcomes can harm the service line's reputation. So to mitigate this, we would ensure that care protocols are based on the latest clinical guidelines and evidence-based practices, ensuring that our treatments are effective and safe. We want to implement robust patient safety initiatives such as error prevention strategies, quality control measures, and continuous staff education on the best practices. Regularly monitor patient satisfaction through surveys and feedback loops to quickly identify and resolve any issues with care delivery or the patient experience. And then lastly, we want to establish a peer review system for clinical cases to improve our decision making and ensure the highest standard of care. By identifying and proactively mitigating all of these risks we just discussed, our center can improve its chances of success and achieve long-term sustainability in a competitive healthcare market. To ensure the success of the Hematology Center of Excellence and build patient volume, a strategic awareness campaign must be implemented. So this campaign will focus on three main pillars: community outreach, physician referrals, and advertising. The goal of the center is community outreach and raising awareness about hematologic conditions to establish the center as the region's go-to facility for specialized care. We will engage the local community through health fairs, free screening such as for anemia or sickle cell disease, and educational seminars on blood disorders and cancer prevention. By partnering with local community centers, schools, and organizations like the Leukemia and Lymphoma Society, we aim to spread awareness and provide support through workshops and support groups. The implementation timeline includes coordinating health fairs, screenings, and workshops in the first 3 months, launching support groups and expanding community partnerships in months 3 through 6, and then continuing to expand screening programs and engagement beyond month 6. Building a strong network of referring physicians is also crucial for ensuring a steady patient flow. So we would offer continuing CME events, implement an easy-to-use electronic referral system, and establish a physician ambassador program. These initiatives will help educate local providers on the center's services and encourage timely referrals for specialized care. Additionally, incentives for referring physicians could be considered. The implementation timeline for this includes identifying referral partners and scheduling CME events in the first 2 months, establishing the referral system and ambassador program by months 3 through 6, and maintaining relationships with referring physicians through regular updates thereafter. To increase visibility, we could leverage digital marketing channels, including social media, Google Ads, and SEO, as well as local radio, TV ads, print media, and billboards. Highlighting patient success stories and sponsoring local health events such as charity runs and blood donation drives will help build credibility and raise awareness about the center's services. The timeline for this includes launching a social media campaign, Google Ads, and creating advertising content in months 1 through 3, running radio and TV ads and sponsoring events, placing print ads all in months 3 through 6, and then maintaining a digital presence with regular updates and patient stories beyond month 6. Here's our projected budget for this marketing and outreach plan for your review. Our total estimated budget for marketing in the first 12 months of outreach totals approximately $65,000. We anticipate steady and sustainable growth in patient volume over the next 5 years with a 15 to 20% annual increase in patient visits. This growth will be driven by several factors, including increased community awareness through outreach and education about blood disorders, resulting in more patients seeking services. Additionally, as relationships with primary care providers, oncologists, and other specialists strengthen, we would expect more referrals for treatments such as chemotherapy, blood transfusions, and hematologic care. High-quality, personalized care will also contribute to strong patient retention and word-of-mouth referrals. Furthermore, the expansion of specialized services, including clinical trials, advanced genetic testing, and research programs, will continue to attract more patients, further solidifying our reputation as the leading provider for hematologic care. So here's our chart on our projected growth in patient visits over the next 5 years. In year 1, we anticipate modest growth as the hematology center establishes itself and patient awareness begins to build, with a projected about 15% increase in patient visits. And then in year 2 to 3, we expect a little bit stronger of a ramp up in patient volume, driven by growing recognition of our services and increasing referrals, alongside the completion of community outreach and educational programs. So we would anticipate about a 17 to 18% annual growth at that time. And then by years 4 to 5, as the center gains a reputation for high quality multidisciplinary care and advanced treatment options, we would anticipate a continued growth with a steady stream of referrals from both healthcare providers and patients seeking specialized care, projecting a 19 to 20% increase in patient visits annually. These projections are all based on an initial patient base of about 5,000 visits in year 1. This is including inpatient and outpatient visits. As patient volume increases over the next 5 years, the center will need to expand its infrastructure and meet growing demand. This includes additional staffing, expanded clinical space, and increased inventory for consumables. So during years 3 through 5, capacity expansion will be necessary, potentially adding more examination rooms, chemotherapy chairs, and staff to accommodate the rising number of patients. With this growth, there will also be a heightened need for medical equipment, particularly diagnostics and treatments such as bone marrow biopsies, chemotherapy pumps, and blood transfusion equipment. Community engagement will be crucial in achieving these growth targets, with continued outreach and physician referral programs to educate patients on the services we offer, especially for early diagnosis and treatment. With an expected annual increase of 15 to 20% in patient visits, the center is well positioned to meet the growing demand for specialized hematology services while maintaining the high standards of care the community expects. Here again is the timeline for implementing the hematology center. as it unfolds in its distinct phases, beginning with the planning and preparation stage. So, in the first 3 months, we'll focus on finalizing the strategic plan, securing approvals, and designing the facility layout. During this period, we can also begin the procurement process for necessary medical equipment, such as our chemotherapy pumps, diagnostic tools, and treatment chairs. Concurrently, recruitment efforts will start for key clinical and administrative positions, including our hematologists, oncology nurses, and support staff. By months 3 through 6, the focus would shift to finalizing staff hires, setting up infrastructure, and conducting training for new employees. We'll also begin setting up the facility with equipment and completing any necessary renovations or expansions to accommodate our growing patient volume. And then during the final 3 months, so months 6 through 9, we'll launch the community outreach efforts, finalize our service delivery protocols, and begin soft launching outpatient services to ensure operational readiness. By the end of month 9, we will officially open the center, offering full clinical services to patients with continued monitoring and adjustments to ensure the facility runs smoothly. So our goal with the community impact is to provide patients with access to specialized care, enhance their patient experience, and provide better health outcomes. For our families, to provide emotional and psychological support and enhance the family support systems available. For our community, we want to strengthen our local healthcare infrastructure, our economic impact, and our community health education. And then long term, we want to build trust and reputation and contribute to public health. The next steps include seeking board approval, securing funding for equipment and staffing, and initiating the project execution phase. So we look forward to your support in moving this vision forward. In conclusion, the Hematology Center of Excellence represents a strategic investment in a hospital's ability to provide specialized, high-quality care to a growing patient population. While the initial costs are significant, the long-term benefits in terms of patient outcomes, market share, and revenue are expected to justify the investment. The next steps will involve finalizing the staffing plan, securing the necessary equipment, and launching a targeted marketing campaign to attract both inpatient and outpatient referrals. We look forward to your feedback and any questions you may have as we move forward with this exciting new service line. And here are some references for your review. Thank you so much.